Smoking causes cancer. Study after study backs that up, but more and more evidence indicates that obesity also causes cancer. Joining us this morning from Gundersen Health System is Dr. Kurt Oettel. Good morning, Dr. Oettel.
Hey, good morning. Thanks for having me this morning.
It's great to have you here. So let's dive into this. What exactly is obesity and how is it defined?
Yes, a good question. So obesity is generally measured by body mass index. And we know that a good percentage of our population is overweight. A body mass index generally between 25 and 30 is considered overweight, but what we're really talking about is obesity with a body mass index greater than 30. That's what really defines obesity, yes.
And the CDC says obesity is a cause for cancer, is that correct?
That's absolutely correct, and it's somewhat surprising that obesity is starting to replace smoking as one of the biggest risk factors for cancer these days.
What exactly is it in obesity that would cause cancer? Where's the connection there?
That's a great question. So we know, just like lung cancer, there's many molecular changes that happen because of smoking, but we also know that there are many molecular changes that happen because of obesity, particularly things like chronic inflammation. We also know that many of the insulin upregulators and diabetic-like processes that happen are promoters for cancer. We also know that patients who have type 2 diabetes, particularly uncontrolled type 2 diabetes, are much more prone to cancer, or if they have cancer, have a worse outcome with their cancer. Yeah, so there are many molecular processes that happen with obesity, but just know that that is a big risk factor and is starting to replace tobacco as one of the big risk factors for cancer.
And Dr. Oettel, real quick before we let you go, let's say somebody wants to get a check on their BMI. How can they go do that?
Talk with your family physician, talk with your healthcare provider, because that's where it really starts. And it really starts with intervention with diet and exercise. So it's dirty words.
Yeah, well, Dr. Oettel, we do appreciate your time this morning. Thank you for this information. It's very important. We're excited to get this out.
There we go.